fungal infections. Oral candidiasis. The candidiasis is the most common type of mycotic or fungal infection that occurs in the oral cavity. This is predominantly caused by Candida albicans. The candidal organisms are present in the oral cavity, digestive tract, and the vaginal tract as normal commensals in many healthy persons. However, they become pathogenic due to some local or systemic changes in the body. Candida, it exists in three forms: pseudo hyphae, yeast, and the chlamydospores. But only the hyphal form is the pathogenic form. So whenever the yeast form it gets favorable conditions, it changes into hyphal form. This is the disease causing form of Candida. There are many predisposing factors which cause the yeast form to transform into the hyphal form, which may include any acute or chronic disease like TB, diabetes mellitus, or anemia, any immunodeficient disease like AIDS, or any nutritional deficiency like iron deficiency, vitamin A deficiency, or vitamin B6 deficiency. Occurrence of the disease has increased since prevalent use of antibiotics, which destroy the normal inhibitory bacterial flora, and also the use of immunosuppressive drugs like corticosteroids and the cytotoxic drugs. So we see that there is a balance between the population of the commensal organisms and our body's immunity. If our body's immunity it decreases, the population of the commensal organisms increases, or we say that they get a favorable environment to reproduce and cause disease. Classification of candidiasis is very easy. They are divided into primary oral candidiasis and secondary oral candidiasis. In secondary oral candidiasis, oral manifestations of systemic mucocutaneous candidiasis are observed, which are caused due to diseases such as thymic aplasia and candidiasis endocrinopathy syndrome. In primary oral candidiasis, the infection is exclusively confined to oral and the perioral tissues. The primary triad. This consists of acute, chronic, and the candida-like infections. The acute forms further consists of pseudomembranous and the erythematous form. The chronic form consists of again pseudomembranous, erythematous form, and the hyperplastic form. The candida-like lesions are denture stomatitis, angular cheilitis, and median rhomboid glossitis. Going with the clinical features, the first one is the pseudomembranous candidiasis. This is the most common form of the disease and can occur at any age, mostly common in chronically ill patients and the infants. The oral lesions, they are soft, white, and curly milk-like elevated plaques present on the buccal mucosa, tongue, palate, gingiva, floor of the mouth. These white plaques, they can be removed with a piece of gauze, and the curly appearance is due to tangled masses of fungal hyphae and intermingled desquamative epithelium, keratin, fibrin, necrotic debris, leukocytes, and the bacteria. Now we will talk about clinical features of erythematous candidiasis, also called as antibiotic sore mouth, because this occurs as a sequelae to course of broad spectrum antibiotics, corticosteroids, or diseases such as HIV. The oral lesions are red in color due to increased vascularity and are consistently painful. The lesion can be distinguished from leukoplakia by its diffuse borders, mostly present on the tongue and is characterized by central papillary atrophy of the tongue. The lesion is mostly associated with chronic smokers. The next clinical type is the hyperplastic type, which consists of both the nodular and the plaque type. These lesions are leukoplakia-like, or we can say that this is leukoplakia type of Candidiasis. The oral lesions are firm, white, persistent plaques which can be homogeneous or speckled and are present mostly on lip, tongue and the cheeks, and is commonly associated with iron and folate deficiency. Now going on with Candida-like lesions. The first one is Denture Stomatitis, which is seen in the maxillary denture-bearing areas and affects the palatal mucosa mostly. Has three different types. Type 1 is localized to minor erythematous sites, and small pinpoint erythematous areas can be seen in the palatal mucosa, whereas type 2 affects major part of the denture covered mucosa, and type 3 it has a granular mucosa. Clinical type is angular cheilitis, which is characterized by erythema and fissuring at the angle of the mouth. The saliva, it tends to pool in persons having deep commissural folds, keeping the area moist and favoring the yeast infection. The diffuse form of angular cheilitis is called as Candidiasis, which is characterized by pain, swelling, erythema with focal ulcerations and crusting, associated with habitual lip sucking and the denture wearers. Now, what is the treatment? Antifungals are the drug of choice. But which? The topical ones or the systemic ones? The topical antifungals are a drug of choice in localized candidiasis, whereas in disseminated form of the disease, systemic antifungals play an important role. Whether the disease is confined to the oral areas or it is systemic in nature, we have to rectify the underlying systemic or the local cause. And on basis of this, we will decide which system we will use to deliver the antifungal drugs, whether the topical route, the parenteral route or the oral route. The topical route is effective for denture stomatitis, angular cheilitis and the median rhomboid glossitis. The parenteral route is effective in any disseminated form of the disease, whereas the oral route is used to treat pseudo-membranous, hyperplastic and the acute atrophic form of the disease. In topical route, clotrimazole can be used in any form, gel, cream or solution, for 5 times a day for 2 weeks. In parenteral route, amphotericin B is given as IV infusion 0.3 mg per kilogram. In oral route, fluconazole or ketoconazole can be given in the dosages mentioned. Thank you guys for watching.